Hi, I'm Dr. Larry Eichenfield from the University of California, San Diego and Rady Children's Hospital.
And I'm Dr. Dawn Eichenfield. I'm also from the University of California, San Diego and Rady Children's Hospital.
And we're going to have a little discussion about vitiligo.
I use ruxolitinib first line for vitiligo in patients that are 12 and older. When we are younger than 12, I think we kind of just have an issue because it's really hard to get the medication off label. So then we're kind of patchworking our regimen together with non-steroidals and other higher potency steroid medications as pulse therapy.
Yeah. Now we have a 10% limitation of body surface area for vitiligo. That's just the way it was studied. I think a sense of what's supposed to be more continuous use with vitiligo, so they were more conservative with that 10% body surface area. But also being a study guy as well as a doctor, I know that we have these extensive studies in atopic dermatitis for patients down to age 2, and while we don't have approval at the time that we're discussing this, of topical ruxolitinib for AD, 2 years of age and older. We only have it 12 plus at the present time. There is that data set that showed very similar safety results. But to come back to vitiligo, it makes me more comfortable, certainly, and I do think I advocate for people doing BSA assessments in vitiligo, and you need to do some cheerleading because it can take, you can get longer, with longer use you get better and better response. So 2 years better than 1 year, 1 year is better than 6 months, so you want to bring people along with you, but with a lot of success, especially in pediatric vitiligo, which we often get earlier in its course, probably more responsive.
I take a lot of photographs just because I feel like with photographs you can really have objective data on what the medication is doing, because I feel like oftentimes after looking at a spot for like 3 or 4 months, you're like, oh, it's really not working, it's really not working. And then you show them the picture and it's like a third of it has filled in. So I feel like that kind of objective data is really helpful for families.
Yeah, so I do think it's great. We never had a drug approved for vitiligo. I think it's fueled other treatment considerations, including some non-steroidal and also systemic therapy. We're being a little more aggressive as well. But I have to say it's been marvelous to bring to patients that a specific drug approved for that with regimens of care that are pretty easy for them to carry out.
It's much easier to have one medication than 2 medications. And which one are you going to do on the weekdays or the weekends?